now joining us, we have Dr. Maggie Sparks, and she is a local dermatologist here in the High Country. Thank you so much for being with us today.
Thank you for having me.
Absolutely. Now talk with us a little bit about your dermatologist office here in Boone. It's just right around the corner from us.
That's right, about 2 blocks from here on Meadowview Drive. And I do the full range of dermatology, which is the treatment of the skin, hair, and nails. Specialize in things like examinations for skin cancer, prevention, and also treatment. I remove a lot of moles that are potentially precancerous. I also do some cosmetic things like treat wrinkles with Botox and filling injections. And I do some laser treatments for hair removal and treatment of spider veins. So it's a very full range of treatment. I see both adults and children. And any kind of skin rashes, and it's a full range of dermatology.
So there are a lot of things that dermatology encompasses.
Yes, there is. The skin is the largest organ in the human body, and most people are not aware of this, but we actually are having an epidemic of skin cancer. Particularly melanoma, which is the most serious form of skin cancer. 1 person dies every hour in the United States of melanoma. Wow. And so it's very important really that every person get screened for this. It's a very preventable disease. Usually if you can see it, it usually comes from a mole that can be abnormally colored, very dark or irregular, and a simple skin exam can usually detect it and remove it. And so it's a very preventable disease, and unfortunately a very deadly disease if not screened for. So.
Wow, that's amazing, because a lot, like you said, a lot of people don't know that, but it is definitely a good thing to be aware of.
I feel like we used to think that only very fair skinned people got melanoma. We now know that actually all skin types, even people who are more tan or darker complected or darker races, can get all types of skin cancer. Melanoma is interesting in that it is caused by both sun and heredity. So the more common types of skin cancer are just from the sun and they're not inherited. Those are called basal cell carcinoma and squamous cell carcinoma. Those are the more common skin cancers, and they're usually not as dangerous. But melanoma, which is the more dangerous skin cancer, often will come from a mole, a pre-existing mole, and those moles can be change from abnormal sun exposure. We know actually now that 1 bad sunburn can double your risk of getting a melanoma. Wow. But there's also a hereditary component. So anyone who has a family history of melanoma, or even if someone in the family has had a precancerous mole, should have a full skin exam just to prevent or to be sure they don't have skin cancer or a mole that could turn into a skin cancer.
Definitely. So how did you get started to be a dermatologist?
Well, in medical school, I took an elective in dermatology in my senior year, and really after the first day or two, it took. I love how visual it is. It's both a medical and a surgical specialty, so I treat rashes and prescribe medications, but I also get to do a lot of surgery. I excise skin cancers and remove moles and other types of skin growths. So it's so varied, and I like how visual it is. I also like the there's a little bit of an artistic aspect to it, because in treating some of the cosmetic issues, treating wrinkles or some of the cosmetic things I do, it feels artistic. So it's very varied and it's very satisfying. I think dermatologists actually have one of the highest job satisfaction rates of any physician. So.
Yeah, so did you ever see yourself doing this before you were in medical school?
No, I thought I was going to do internal medicine, actually, and my internal medicine mentor said, you should at least do an elective in your senior year in dermatology because it's very useful. People always come in with rashes or ask you to comment on a mole, but once after a couple days of that elective, I decided I knew I was home. So.
Fantastic. Now, is there something that people most commonly come to you for?
I think the most common thing is for moles, to check moles out. I mean, almost everybody has some moles, and because moles can turn malignant, that is probably the biggest concern that most people have. I do have a lot of people who come to me for either teenage or adult acne, and other types of rashes, eczema, things like that. So I guess there's not one overarching thing, but I do Because up here in the high country, we have a lot of people from Florida. In the summer, I do a lot of treatment of skin cancer because we certainly have a big population of people here who've had way too much sun.
Right.
So.
Now, is there any kind of tips or advice that you can give us for avoiding skin cancer and doing everything you can to prevent that from happening?
Yes. I mean, I think the biggest tip is to get an exam. And a lot of times people say to me, well, I check myself. Well, you know, dermatology is a specialty, and it's good to check yourself, and it's good even to have your family doctor to check. But there really is a value of having a dermatologist check and do a full skin exam, because we are the ones who see the skin cancers the most and really know what they look like. And they don't always look like what they look like online or in the textbook. Sometimes there are unusual skin cancers that, you know, your doctor might not even know or recognize. So that's the biggest thing. The other thing is to really watch your sun exposure. And most people don't actually use sunscreen either at all or correctly. Most sunscreens involve a chemical reaction, so they don't block the sun from the moment you put them on your skin. You have to put them on 45 minutes to an hour before you're even exposed. And then they have to be reapplied because it sweats off, or if you swim, it washes off.
Right.
And so a lot of times people get out in the sun, and after they're out for a while, they think, oh, I better put some sunscreen on. By then, it's kind of already too late. They've already exposed themselves to too much ultraviolet radiation. The other thing is that I tell people that sunscreen alone is not enough, that you still need to avoid the peak in the summer. From about April to October, you should avoid being outdoors between 11 and 2 as much as you can, especially in the lower latitudes. And that you should use hats and clothing, and always opt for shade if it's available. You know, if there's an umbrella, sit under it. But don't really seek to try to get too much sun.
Right. And speaking of sunscreen, there's like the 30s and the 50s and the 70s. Is there a difference in that? I know that some block it, but
yes, there is a difference. And what those numbers stand for is SPF is sun protection factor. And that is a number that first came out measuring how much of the shorter the burning ray, that what's called UVB. So it's how much, it's a ratio of how long before you burn with the sunscreen versus without the sunscreen. So an SPF 15 means you could stay out 15 times longer before you would burn. But we have now discovered that the longer wavelength, the UVA, is also dangerous. We used to think it's more thought of as a tanning ray, not a burning ray. But we have now shown that that does cause skin cancer, all types. And so you need not only a high number SPF, and there is a value to using these higher numbers, 50, 60, they do something, but you also need to look for UVA coverage, that it has a UVA blocker, because the number really only relates to the UVB.
Okay, well that's interesting. I needed to know this because I have children, so I'm always wondering, you know, what is the difference between that kind of thing, but we want to look for UVA as well.
Yes, absolutely.
Perfect.
Well, some great tips there. Now talk with us a little bit about the hair and nails side of dermatology.
Yes, so there's a lot of different conditions of the hair and nails. With hair, a lot of times we have a situation of either too much or not enough. So people see me for hair loss, and there are different kinds of hair loss, some of which can be treated with medications. There is also laser treatments that we can do for unwanted hair. So women that get facial hair or that want to treat their bikini or underarm area or other areas, other types of unwanted hair, can be treated with a laser. Nail conditions are also something that we deal with, and the most common one probably is fungal infections of the nail. And so it's important to treat these infections because sometimes people can get secondary bacterial infections if they have a fungal infection. So there are other people don't realize too that you can actually get a skin cancer under the nail. So if anyone who has a black spot that occurs under a fingernail or under a toenail, that needs to be evaluated because it is possible to get melanomas in those areas. So.
Wow. Well, you have given us a lot of great information today. Yes. Thank you so much for coming in to talk with us.
Well, thank you for having me.
Thank you.
And remind us where your office is located.
It's at 381 Meadowview Drive in Boone. Meadowview is just down from the Greenway, and just right around the corner from here. So.
And your hours?
We're open pretty much every day. We open around 8:30 and stay open until about 4:30.
Okay.
Monday through Friday.
Okay, so definitely call and make an appointment. Okay.
All right, well, great. Thank you so much. And we will be back right after these messages with more of the Mountain Television Network.